now going live on YouTube. All right, good afternoon. I am Jessica Carroll, the Interim Program Manager for Measure 110, and I will be assisting Sabrina Garcia, a Tri-Chair, with facilitation for today's meeting. The Oversight and Accountability Council welcomes and encourages community input. Members of the public are invited to submit public comments or get on our interested parties email list by emailing oha.measure110@odhsoha.oregon.gov. That email address and more information about the council can be found on the Measure 110 OAC website. For more information or support with community engagement, please contact Sydney McConnell. She's going to drop her email in the chat. OAC members have asked that OHA and other staff who are present in the meeting space introduce themselves in the chat. Please share your role with the agency. And if you are a subject matter expert, your area of expertise. And I'll send it back to Sabrina to have Sydney call roll.
Okay, thank you very much, Jessica. And so then now I will be turning it to Sydney to take roll for attendance.
Thanks, Sabrina. And I just want to apologize. I had a low connectivity come up, so I'm off camera, but it's nice to see everybody. When I call your name, if you could please say here. Amy. Amy has not yet arrived. Blue.
Here.
Hi, Blue. Let's see. Carlos.
I'm here.
Hi, Carlos. Caroline.
Here.
Hi, Caroline. Dharma. Dharma here yet? Come back. Henry.
Here.
Hi, Henry. Hubert.
Here.
Hi, Hubert. Keisha. Keisha, you there? All right, Leticia.
I'm here.
Hi, Leticia. Melinda.
Here.
Hi, Melinda. Morgan.
Here.
Hi, Morgan. Nicole.
I'm here.
Hi, Nicole. Onisha. I see Onisha waving. Onisha, you want to drop it in the chat just so we have it in the record? Oh, and I see Keisha's here too. That's okay. Thanks, Onisha. See you in the chat. Ron.
Here.
Hi, Ron. Sabrina.
I'm here.
Sabrina and Zeb.
Yes, I'm here.
Hi, Zeb. And
Hi.
Steve.
I'm here. Happy Wednesday, everybody.
Steve, and then Dr. Richardson, I do not see. Just checking one more time, has Amy arrived? And Dharma. Don't see Dharma yet either. Okay, we're at 16. Back to you, Sabrina.
Thank you very much, Sydney. And then I would like to call the agenda. Today I'm going to have the grantee subcontract presentation given by Kristen from OHA. And then we're going to have the burn policies vote. And then we're also going to talk again about the CCBHC committee discussion, and that is going to be with Kim Hoover. So we have a pretty packed agenda. And so right now I'm going to welcome and turn it to the grantee subcontract presentation, and the person given that will be Kristen. Welcome, Kristen.
Thank you, Sabrina. Sydney, can you pull up the slides, please? Thank you. My name is Kristen Donheffer, and I work for OHA on the Measure 110 team. Today, I am going to quickly or briefly present a request from one of the approved burn partners to modify their budget. Next slide. So as a reminder, several weeks ago, the Oversight and Accountability Council gave guidance that any change between budget categories that was more than a 25% difference of the overall not to exceed amount would require Oversight and Accountability Council approval. Otherwise, OHA could make minor adjustments. So today, the OHSU Partnership Project is requesting $19,525 of their $56,875 award to be set aside for a subcontract with the Everly Project. And this represents a 34.3% difference, hence triggering the guidance that the OAC approves this change. The OHSU Partnership Project would set aside this funding to be used by the Everly Project to purchase harm reduction supplies. And as a quick reminder, the Everly Project is also an approved Measure 110 provider. Both OHSU Partnership Project and the Everly Project are approved harm reduction providers in Multnomah County. The OHSU Partnership Project would continue to offer harm reduction services with the remaining $33,181 within the No Wrong Door burn in Multnomah County. And upon approving this budget, OHA will bring the actual subcontract back to the Oversight and Accountability Council for final approval. Next slide. So to offer a little bit more details about this request, the OHSU Partnership Project is implementing a harm reduction support group for individuals to access harm reduction supplies and to facilitate connections and referrals to other burn services. All of the No Wrong Door burn harm reduction providers are planning on participating in this, supporting this support group. OHSU is proposing a subcontract with the Everly Project to assist with staffing the support group and to purchase and provide harm reduction supplies. OHSU will continue to also provide some harm reduction supplies, interpretive services, and space for the support group to convene as outlined in their approved budget and application. So today's vote does not guarantee that subcontract request. It just gives budget authority to OHSU to move forward with that subcontract, which again, we would bring back to you all for approval. And that subcontract would include, the details about this arrangement and exactly what everyone's role would be. But I would just note that nothing is changing in their overall scope of work or categories of what they were approved to do by you all. And I would also note that the program staff and DOJ has reviewed this request and presentation and has no concerns with bringing it forward to you all. So I think the last slide is just a proposed motion to approve the proposed revision to the OHSU budget as described in the previous slide. And with that, I am happy to answer any questions.
Go ahead, Blue.
So I just like a little bit more clarity. I was trying to write down what I was reading and hearing. So are these funds going to be used to pay for any staffing for the Everly Project? Because the way it looked on the slide, it looked like some of the money was going for their staff, and I just wanted some clarity. And also, if there's any more clarity around why OHSU can't just buy the supplies themselves, if it's just for supplies, why it needs to be another provider, that would be helpful.
Sure. My understanding is that the funding to the Everly Project would mostly be funding, and I'm looking at my notes over here, so sorry, I'm not making eye contact, to facilitate the purchase of supplies. I think there is some, there would be some staffing, but as a reminder, I believe the bulk of what you all approved the Everly project for back in August was staffing costs. As for why OHSU wants to subcontract, I think that's just their preferred business arrangement. And our general approach has been to allow our providers to really work on the details of their own business arrangements and approaches to providing these services, and to facilitate bringing them forward to you all. So I can't comment on exactly why, aside from the fact that that is what they have requested.
Thank you, Kristen. Did that answer your question, Blue?
Yeah, I think that's probably as clear as it's gonna get. So thank you.
Thank you, Blue. And thank you, Kristen. And then Henry?
Hi, good afternoon. I'm just curious, or not just, I am curious about, you mentioned a support group. Is that when you're talking about staffing for the Everly project, and I'm not familiar with the Everly project, so maybe this is something that everyone knows and I don't know. There's discussion of staffing to facilitate a support group. Is that part of that? Is the support group, what I'm understanding, for patients who are seeking to access harm reduction services through OHSU's burn? Is that accurate?
So my understanding is that the harm reduction providers in the No Wrong Door burn are getting together to form a harm reduction support group that would meet at OHSU's HIV Day Center and be staffed by all of the harm reduction providers. Within that support group, we're only looking at the small piece of that OHSU and the Everly project are contributing. It's my understanding that the other approved harm reduction providers are also contributing staffing and expertise and supplies to fully support a robust group for the community.
Got it. So this is like a support group for community members who are seeking harm reduction services and will be located at OHSU.
Yes, that's
Okay.
my understanding.
Thank you.
And I just wanted to ask Kristen, so these are all, this was all previously approved by the council. Now they're just looking to subcontract out for whatever reason that they're asking to receive their supplies from somewhere else, but still in alignment with what the council agreed upon when we approved the funding. Is that correct? Would that be fair to say that?
Yes, that is correct, Sabrina.
Okay, thank you. And I also see that Blue has her hand up.
I just had a follow-up around the support group. Is that where folks would have to go to get supplies, or are there still other lower barrier places for people within that burn to get harm reduction supplies?
My understanding is that this is one of several outreach strategies that this burn is using to provide harm reduction services. So no, it would not be the only place in the No Wrong Door burn that people could access harm reduction services and supplies.
Okay, thank you.
Can we please put the motion back on the slide, and then if we could, please.
Oh, Sabrina, you're muted.
Okay, so this is always a little tactful for me. So I would like to move to approve the proposed revision to the OHSU budget as described in the previous slides.
Second, Keisha.
And is there any further discussion? Jessica, I apologize.
No, it's okay. It's okay, because I think I forgot to put this on the detailed agenda, so I just want to apologize. Do we have any conflicts of interest with either OHSU or the Everly project? If you'd like to declare a conflict of interest, please do so now. Hearing none. I think we're good to vote. I apologize for that, Sabrina.
I'm hearing no further discussion. Sydney, would you like to take roll or take the vote?
Yes, I'm going to take my screen down here. Sorry about that. And let me just get my screens back in order. All right, motion to approve the proposed revision to OHSU budgets as described in the slides we just saw. Let's see, it looks like Amy still has not arrived. Blue, how do you vote?
Abstain.
Thanks, Blue. Carlos?
I'm kind of like, I'm not sure.
I can come back
That-
to you.
Okay, thank you.
Yeah, sure. Caroline?
Yes.
Thanks, Caroline. Has Dharma arrived? I don't see her. Okay, no Dharma yet. Henry, how do you vote?
Yes.
Henry. Hubert?
Yeah.
Thanks, Hubert. Keisha?
Yes.
Thanks, Keisha. Leticia?
Yes.
Thanks, Leticia. Melinda?
Yes.
Thanks, Melinda. Morgan?
Yes.
Thanks, Morgan. Nicole wrote that she abstains in the chat. Nisha votes yes in the chat. Ron?
Yes.
Thanks, Ron. Sabrina?
Yes.
Thanks, Sabrina. And Zeb.
Yes.
All right, and then Carlos?
Yes, I'm sorry. I was like trying to hold several thoughts at a time and it just, thank you.
Oh, that's okay. All right, so that passes with 12 yes and 2 abstentions. Back to you, Sabrina.
I did have a question, but it wasn't really related to that particular proposal, but it has to relate to harm reduction, which is I'm confused about the status of the harm reduction clearinghouse. And I'm just wondering if at some point someone could update us on the availability of supplies from the clearinghouse to provide harm reduction providers all over Oregon.
Yeah, Ron, I think that's a very good conversation piece. And if somebody could note that so we can put it on the agenda or for this upcoming tri-chair meeting.
Noted.
Thank you.
Okay, if there's no other further questions, then I would like to introduce our next presenter about the policies presentation, and that's going to be Sam Byers. Is she here? Thank you.
I am, sorry. I'm trying to get my camera and unmute. Just in regard to the policies, Jessica, I want to pause just to see if there's anything or any way you want to introduce this or what would be most helpful to start with.
Yeah, so I think just to give like a general idea of what we're going to do today, we sent the policies out for feedback and so we could make revisions. We did get feedback and revisions on one of the policies. The rest we did not. So it is our goal here to pass the ones that didn't, or vote on the ones that did not receive any feedback, that nobody had any changes to, and then bring the ones that we're still kind of working through that feedback next week. And this way we might be able to get through it a little more quickly. So I think with that, it's just a matter of voting on the policy package that you all received in your email.
And then also, Jessica, just to add, the two policies that are still in revision, one is related to the data collection that is being reviewed. And then Dharma has really graciously provided some time to us to finalize the LGBTQI2S+ and gender affirming policy or policies. That work with her will be on Friday morning. So also with the intent to have that policy to you at the same time. So those are the two that are left outstanding that would not be part of this.
Ron, is your hand still up? I apologize for interrupting, Samantha.
No, it's back up.
Okay, would you like to ask your question before we get started?
Yes, which is really kind of just being clear on what we're doing. From my perspective, I want to make sure I understand it. And so we're not approving policies, we're approving templates that can be used by the providers to help them submit policies to us.
Correct.
Is that correct? Okay, just want to be clear that that's what we're doing.
Thank you, Ron, for clearing that up.
Crystal clear, Ron. Thank you. Same. Oh, sorry.
And now Samantha has her hand back up.
I'm sorry, not to delay. And just to clarify, Ron, to your question, that's yes, but also keeping in mind that a provider could potentially take some language that's in the policy, right, as well as use the questions as a way to be thoughtful. So I just wanted you to know, like, the template is
It's not just a template, it's also language that could be useful for submitting.
potentially, right? Yeah, I mean, and the template is just an idea of structure, but you know that there are words in there that somebody could cut and paste potentially.
Thank you.
Did that address everything, Ron? For now?
Yes, that was perfect. Thank you. I'll take my
Okay.
hand back. I'll take my
Okay.
hand back.
Thank you. And then Blue, did you have a question?
Yeah, I guess just piggybacking off of sort of what Ron had asked or stated. It's my understanding, and I'm not sure if it's correct, that we do, this is sort of like the minimum, or like that we do want providers to have this language within their policy. Like they couldn't take the template and pull out everything that's essentially making an organization inclusive or welcoming to everybody. Like that there are points in there that we would need to see in a policy if they didn't exactly follow the template, so that everyone's sort of being treated the same. Is that accurate or no?
So I'm not sure I followed that. It sounds like, and just let me know if I heard you correctly. So it sounds like you're asking, like, because these are templates and people don't have to like adopt them as is, that an organization may choose to adopt part or all. Is that what you're asking?
Yeah, I'm asking, like, if that is an option, could I take, if I was a provider, could I take the template and say, yeah, this is terrible, and just, you know, make a policy that is not as inclusive or welcoming? I'm not completely sure I understand. Like, my understanding was that the template had sort of like the minimum things that we wanted to see in providers that would need to be carried into a different policy if they wrote their own, but I'm not sure if that is accurate.
Did you want to answer that, Samantha?
Yes, even though I vowed I wouldn't say any more. Thanks, Sabrina. I am so Blue. I think I understand what you're saying. It's like, so, you know, the intention around the policy was really to help some of our newer or smaller providers coming to the table that don't necessarily have like a department that is writing out policies for them, right? And so it was kind of a quick way to, you know, provide some examples of what a template looks like for them to not have to create their own. But I do wonder if Allison or Shannon want to weigh in on sort of any more of the details of that.
Yeah, this is Shannon O'Fallon from DOJ. Sorry, I'm not on camera, and Allison may need to kick me in and break in here. But my understanding is that the rules require that burn grantees have specified policies that address the various things that are in rule, but we don't have particular minimum standards for what needs to be in those policies. So actually, Blue, I think it is the case that an organization could say, thank you very much, OAC, for these templates, but we're gonna do our own thing.
Okay, thank you. That's helpful. I know Sam was mentioning newer organizations, and my first thought was actually there are some organizations that have been around that have historically marginalized folks that, are also of concern. And so I don't know that we have the answer on what to do about that. But that was sort of what I was thinking of when I was listening to this. So thank you.
Okay, if there's no more further discussion, I'm going to turn it back over to Samantha.
Thank you. I don't think I have anything else unless there's a question that would be helpful for the council on, anything around the template.
All right, so I think we have a sample motion. So there are two things that we kind of have to vote on here with these. One is the cover sheet, and the next is the group of policy templates. So I think we're going to go in that order, and we're just going to give Sydney a minute to bring those up. And I'm going to turn it back over to Sabrina, our fantastic host.
Thank you very much. I'm going to go ahead and say I would like to move to approve the policy template cover sheet received by the OAC on October 17th, 2022.
Second, Keisha.
Is there any further discussion? Hearing none, I would like to turn it back over to Sydney.
Thank you. I'm just finalizing my notes here. All right. So the motion to approve the policy template cover sheet. Amy, how do you vote?
Yes.
Miss Amy Blue?
Yes.
Blue Carlos?
Yes.
Thank you, Carlos. Caroline?
Yes.
Thanks, Caroline. Has Dharma arrived? Can't see my list. I apologize. Okay. Henry?
Yes.
Thanks, Henry. Hubert?
Yes.
Thanks, Hubert. Keisha?
Yes.
Thanks, Keisha. Leticia?
Yes.
Thank you. Melinda?
Absolutely yes.
Thanks, Melinda. Morgan?
Yes.
Thanks, Morgan. Nicole?
Yes.
Oh, thanks, Nicole. And then I see Onisha's yes in the chat. Ron?
Yes.
Thank you. Sabrina?
Yes.
Thanks, Sabrina. And Zeb?
Yes.
All right, that passes with 15 yes.
Thank you, Sydney. And Jessica, I'm a little confused about how to move forward with the next piece.
Oh, I gotcha. Sydney, can we bring up the next motion? This next motion is on the group of policy templates. And they are listed here, and I will let Sabrina take over.
Okay, so I'm going to go ahead and do this. Do I have to read it verbatim on the slide, Jessica? Is that preference?
It is the preference that whoever makes the motion reads the slide verbatim if they so choose.
I'm going to go ahead and make the motion, and I move to approve the 8 policy templates received by the OSC on October 17th, 2022. Culturally and linguistically specific services, culturally and linguistically responsive services, accessibility for people with intellectual, developmental, or physical disabilities, youth-friendly and inclusive services, patient-centered and non-stigmatizing services, trauma-informed engagement and care, services for parents or non-traditional parents with minor children, and services for pregnant persons.
I second.
Is there any further discussion? Hearing none. Sydney, would you like to take the vote?
Yes, so the motion as written on the slide here, I won't reread that all for all of y'all's patience. Amy, how do you vote?
Yes.
Thanks, Amy. Blue?
Yes.
Thanks, Blue. Carlos?
Yes.
Carlos. Caroline?
Yes.
Thank you. Still no Dharma. Henry?
Yeah, I'm unable to see the slides, so I will abstain. I don't know what we're voting on. Thank you.
Can y'all not see the slide?
I can see it. Can everyone else?
I can see it.
I can. I can't either.
I cannot see it either. All I see is the one that says move to approve the policy template cover sheet. That's the only one I see.
I can see it.
How
Can we,
strange.
before we move on, is there a way, Sydney, that you can take it down and put it back up? We're gonna give Sydney some grace here, because it sounds like some of us can see the right one and some of us can't. So let's let Sydney get it back up, and maybe we can get to a place where we can all see it, and then we can all vote.
Is it there now? I took it down and put it back up.
Yes. I see it still.
Henry, can you see it as well? Oh, okay. So do we want to go back? Henry, would you like to vote? Or do you want to stick with your abstention? Just giving you.
Yeah, I just don't, I don't want to cause more delay. I can read through this. I just want to be able to know what I'm voting for. Thank you.
And I also sent out the slide, the policies for review a couple weeks ago, and I sent them out again Monday. So y'all should have them, but if you didn't receive them, then that's another.
We can come back to
No,
Henry.
Yeah,
after
we
he
can
has a
come back,
chance.
Henry. All right, next is Hubert.
Yes.
Thanks, Hubert. Keisha?
Yes.
All right, thanks, Keisha. Leticia?
Yes.
Thanks, Leticia. Melinda?
Yes.
Thanks, Melinda. Morgan?
Yes.
Thanks, Morgan. And Nicole, I see your yes in the chat. Onisha, did you? Oh, there's Onisha's yes in the chat too. Ron.
Yes.
Thanks, Ron. Sabrina.
Yes.
Thanks, Sabrina. Zeb.
Yes.
All right, thanks, Zeb. That passes with 14 yes and 1 abstention. Oh, Henry changed his vote to yes in the chat as well. So that passes with 15 yes. Okay, thank you all. Sorry about that.
Okay, thank you, everybody. We got those votes done pretty fast. And so I would like to now present Kimberly Hoover from the CCBH C committee, and she can bring her discussion to the table.
Thanks, Sabrina, and thank you all for allowing me a few moments here in your meeting this afternoon. So my name is Kim Hoover. I am the program coordinator for Certified Community Behavioral Health Clinics in Oregon. And we are putting together a steering committee that centers community perspectives. And so we did send out an invitation to this group, I believe on the 12th of October. inviting members of the Measure 110 OAC, because one of the things that we are trying to do is integrate the perspectives of existing OHA committees in the development of this program, since it will be an integrated behavioral health program that could potentially reach statewide status. So I'm happy to contextualize as little or as much as would be helpful for this group. I recognize it's also another time commitment, and many of you all are working multiple jobs. So please let me know what would be helpful to contextualize on the activities of the committee and sort of the deliverables we'll be working on together, as well as if more information about the program itself would be helpful.
Yes, I had a question. I was wondering how many more council members would you like from the Oversight and Accountability Council? I believe we have one person that signed up for one of the slots now. I was just wondering how many more that you had that you're looking for.
We're looking to receive at least 4 members from the Measure 110 committee. I haven't received an official notice from any individual from Measure 110 that said they were interested yet. So.
Thank you. So that's a total of 4 that you're looking for. And then also there is a vote, or there's not a vote, there's a comment I just wanted to read from Onisha that says, where do we need to email to sign up? And that's Onisha Cochran, and she's unable to talk because of her speaker.
Yeah, so you are welcome to just respond to that email thread, so directly to my email, and I can put my email again in the chat, which is, yeah, that would be the quickest way to respond.
Or you can always email me, Onisha, and I'll get your email over to Kim.
Thank you, Kim, and thank you, Jessica. Ron?
Right, I was just you said you were gonna offer an overview, which would be great. What I think I know is that these were SAMHSA grants, and they went to a certain number of entities, like 5 or 6 entities in the state, and they're providing specific services. Maybe you could say what those are, and then I'd be interested in kind of what the future looks like as well, in terms of, I understand there were 2 rounds of grants. I don't know if there's going to be more grants coming, or if it's going to be continually funded, or if you could explain that, that'd be great.
Sure, I'm happy to explain. I did want to ask Steve, did you want to do any contextualizing before I give an overview?
Yeah, thanks, Ron, for your question, and happy to turn it back to you. Just for reference, these certified community behavioral health centers we consider to be the wave of the future, and the reason for that is they provide a wide array of integrated care, including primary care, physical health care, substance use disorder treatment, crisis emergency services, et cetera. We were, as you are suggesting, Ron, one of 8 original demonstration states to receive funding to stand up this model, and Kim's team is all about strengthening and refining our approach. There's going to be increasing questions about the integration of the burns with the rest of behavioral health care and maybe healthcare more generally. I think this is an opportunity for folks who are interested to really get in the weeds a little bit and to help shape the development of our CCBHC model here in Oregon, to ensure that there's that these array of services are complementary, that they support each other. So I think it's a really nice opportunity for this group to provide input in that planning process. Thank you.
Yeah, thank you, Steve. And as he mentioned, we are a demonstration state, which kind of gives us a leg up in that we've been in the demonstration for the duration of the program so far. And we do also have expansion grantees, which may also be what you were referring to, Ron. That gets a little bit complicated because there are CCBHCs that are regulated by the feds, and then there are our demonstration sites in the state. But as Steve gestured, it is a holistic, integrated model of whole person, patient-centered care. We require primary care integration as an Oregon-specific requirement for CCBHC. And another thing that makes the model really effective, I think, to us, is that it is such a community-based model. What we know now is that over time, they have just spread out into their community. They have so many appendages of community-based outreach and including community-based partners in their care coordination and things like that. So when you look at overlaying Measure 110 with CCBHC, for example, there's some similarities in that regard. And yeah, as of right now, there is legislation being written, a legislative concept that would potentially take the program statewide. And so we're in this unique moment where we really get to refine and develop the criteria. So everything from what we would want to provide technical assistance on defining as patient-centered or integrated treatment planning, all the way to what we require as the scope of services, or how we formalize partnerships with community-based partners or culturally specific providers, things like that. So this is really a unique moment in that regard that we could use community perspective to help us develop.
Thank you. Jessica, did you have something?
I do. It's just really, it's incumbent upon me to remind everyone that please sign up if you're interested. However, there will need to be an analysis consideration of dual lucrative office. So when you send in your request to throw your name in the hat, we will definitely, that will be done by DOJ. So I just want to acknowledge that. And I will put my hand down.
Thank you, Jessica. Henry?
Yeah, thank you, Kimberly, for coming and discussing this with the committee. I guess I'm also curious about, will there be some talk about, how these services through CCBHCs are being, how they're being, what's the word I'm looking for? Paid for, I guess, in the sense that, I've worked for a CCBHC, and it seems like, or a community-based, I've worked for an organization that was getting that funding. And sometimes it seems like there's some difficulty around fee for service versus capitation. So and then I think that it's nice to have the funding streams. It's also difficult when you're faced with the same issues that we've always been faced with in Oregon, which is around, having enough providers to provide services, around the acuity of patients and not having enough services for a higher level of acuity. That kind of stuff, I think, is continuing to be an issue. So I don't know if part of this committee is going to address those things, or if there's some type of conversation that can be had. It seems like, let's see here, fee for service is always more of a challenge, has a rate they pay us, it's calculated based on our costs. So yeah, I think sometimes, if you have high acuity patients, there's sometimes a feeling that the organization is actually losing an opportunity to be reimbursed for those folks if they're capitated, if that makes sense.
Maybe pieces of it, which I might need your help teasing out. But so one of the things that distinguishes this model is the prospective payment system. So the PPS, which includes a daily rate for any service provided, mental health, primary care, SUD, even peer engagement, et cetera. And that rate is designed to include non-billable services like care coordination and outreach. And so in what our providers report to us is that payment system actually allows them to do all kinds of non-billable activities that fee-for-service normally doesn't. There's definitely things going on with capitation and sort of one-time payments that are affecting the PPS currently. And to answer one of your questions, yes, we will definitely be looking at the payment methodology. On the national level, there are multiple payment methodologies. We opted into PPS 1, which is a daily rate. And there's also a second one that is more based on population health and population management, but you also need really robust statewide health information exchange to run that sort of payment model. And that can be, obviously that can work well to tying to things like incentive payments and things like that as well. So there are definitely things that we need to address that are specific to Oregon and how we are compensating providers, and also the distinctions between CMHPs and non-CMHPs, because as of right now, competition is open and some of those things shake out differently for like a nonprofit versus a CMHP. So yes, definitely. One other piece that you did mention, I'm forgetting how you stated it, but we have also had multiple providers tell us that the work that an individual can do under this model is really amplified. For example, if you have one primary care provider, like an MD on staff at a CCBHC, their work is amplified because they have a multidisciplinary team of folks that are wrapping around them and providing services in the interim. And sometimes the PCP acts as a release valve for the behavioral health clinician who is overloaded with outpatient appointments, for example. And then we have care coordinators that kind of take care of everything in between. So the program definitely needs development, and the workforce shortage is real. And we would be looking at the payment methodology as one of those components.
Yeah, I think that was part of the concern was, you know, if there are specific caseloads, or, you know, if there's a requirement to continually provide intake services, and you know, whether there's a requirement to say, yes, we'll continue to take folks when there aren't enough clinicians to provide services for those folks. You know, I think that's part of the thing around workforce retention that, you know, I've experienced with colleagues and folks in those systems. So I don't know if there's a part of, you know, this committee that is going to be talking about that stuff. Not to take up too much time. Thank you.
Yeah, I mean, I think the behavioral health workforce shortage affects the whole system, and so it would definitely be addressed at some point. Yeah.
Okay, thank you for all your valuable input and questions. And I just wanted to call out to an OHA staff member, Onisha's comment in the chat box. And then also, did you have something, Ron?
Well, I guess it was really more, just the more I think about this, the more I think it's probably where I should probably want to get involved. I was just kind of reading through the purpose of the expansion grant. So the purpose of the program is to increase access and improve the quality of community mental and substance use disorder treatment through the expansion of the CCBHCs. CCBHCs provide person and family-centered integrated services. Expansion grant program must provide access to services including 24/7 crisis intervention for individuals with serious mental illness or substance use disorder, including opioid use disorders, children and adolescents with serious emotional disturbances, and individuals with co-occurring mental and substance disorders. And it just seems like, and so it's this line that I'm seeing. So we've got the Burns, you've got the counties providing programs, the CCOs, the CMHPs, and I'm just trying to integrate it in my mind. Is this supposed to be all braided together, or are these all maybe that's something Steve as part of the vision can talk about? Because I'm seeing them another thing alongside what's happening, as opposed to everything kind of being commingled and braided. And one of the things that the council has talked about is kind of protecting SUD funding from kind of encroachment from mental health service delivery.
Sabrina?
Yes,
Okay to
Steve,
jump in?
thank you. Yes, thank you, Steve.
Yeah, really good questions, Ron. And those are the very things that we're talking about moving forward. So we have community mental health programs. Many of these are, you know, about half of the CMHPs are county run. The other half are private nonprofits. Some of these are also CCBHCs, and there are also CCBHCs that are part of Oregon's county-based community mental health program. What we really like about it is this integrated and broad service array and the flexibility in how things are paid for. That gives a lot of power to developing services that really work well for people. The question on the table that I started with is, you know, policymakers are wondering, well, how do these jigsaw puzzle pieces all fit together? The CCBHCs have their own source of funding, so I don't believe that there's any risk of these type of services, you know, pressuring the council for funding. That's not the issue on the table. The issue on the table is for people, how do we take advantage of this array of service and to sort of integrate it within the burns now that they're stood up? And I think that's where the real opportunity for some strategic thinking about, what the landscape ought to look like 5 years from now. We have a lot of work yet to do to stand up CCBHCs across the state. That's going to take multiple biennium to do that. And what are the implications, statewide, how many and where? That's what we're working on. And also crafting the model so that it's right with Oregon. Well, no other state but Oregon has burns in it. And so we have a unique opportunity to work on how do we build these services in so that the people who need services have access to the wide array of services that are offered both by the CCBHCs and the burns. As we look at, and the crisis centers that mobile crisis, the call line, et cetera, these things really need to be thoughtfully put together in a way that doesn't undermine any of them, but builds on the strengths of those systems as they're being set up. So I think it's a really cool opportunity for council members to play a role in helping to shape it with the burns in mind. Did I answer your question, Ron?
No, absolutely. Thank you so much.
Welcome.
Thank you, Ron and Steve. I just had two questions I would like to ask really quick, and then I'll let Henry go. One, Kimberly, is I know that before that you said something, you mentioned about it not just going to the community mental health provider, that it's going to be open for, I forgot the word that you used, competitive. Was that the proper word? And so I was wondering if you can a little bit, if you know what I'm talking about, if you can highlight on that a little bit. And then if you could also mention how many other councils and committees are considered in this process or already agreed to be a part of this process. Thank you.
Sure. So we touched base with at least 5 existing OHA councils to recruit members. And the answer to the other question is that, we currently have 9 CMHPs, 2 nonprofits, and a hospital system that are CCBHCs. And as long as we are going to, what happened recently is that SAMHSA announced a mechanism for the demonstration itself to expand, which is separate than the expansion grants that Ron has mentioned. And that would allow us to open up who can apply to be a CCBHC. And at least currently the guidance from OHA is to allow that competition to remain open to the institutional types that can take on the whole scope of services for a CCBHC.
And that was a demonstration?
That's right. The demonstration is a different financial mechanism than the expansion grants.
Thank you very much, Kimberly. And then I would like to turn it to Henry.
Yeah, I appreciate the discussion again. And I think that I do appreciate how we are focusing in this committee on substance use disorder. I also want to say that, I don't know if I have a unique perspective as someone that treats both, that is treating co-occurring disorders. And really, I really don't see a distinction between the two. I think that mental health and substance use disorders are both mental health disorders. So, and there's a lot of co-occurring disorders, right? I think SAMHSA talks about like 9.2 million adults in the United States with co-occurring disorders. So I know that when we're talking about treating substance use disorders, we're talking about treating mental health disorders. I guess that's an aside. I do think that we all, as a committee, we've also funded organizations that are parts of burns that are also CCBHCs. So the organizations here in Hood River, I can think of the Center for Living as a CCBHC and is also part of a burn. So if we want to talk to those folks about how they're planning to integrate those systems, I think that might be of benefit, maybe going and talking to the organizations that we funded and provided burn money to, who are also part of a CCBHC. Thank you.
Thank you very much, Henry. Does anybody have any other questions for Kimberly? I appreciate you for taking your time to come again, Kimberly. I think we got a lot of possible interested people. I see that Jessica did put that if anybody's interested, to please respond via the email so that can trigger that process. And then if we have nothing else, I'm going to turn it. Amy has a question, so I'm going to turn it to Amy.
I'm just going to be real quick. I did reply to an email. I thought it was from Sydney, but it looked like it was forwarded. I don't know. So I hope I responded correctly. So I will respond to Jessica as well. But yeah, it sounds really good. I do co-occurring treatment. So the importance of it is so needed. So yeah, I'm excited. Thank you.
Thank you, Amy. And yes, there was a lot of good conversation today. And I would now like to turn it over to, and thank you, Kimberly, again for coming. And now I'd like to turn it over to Jessica for our updates.
Yeah, thank you so much, Sabrina. I really appreciate that. All right, so now we just have some OHA updates. So first update I have is the rules process update. We held the Chapter 944 public hearing yesterday. It was attended by some. We only received one comment. We are still collecting public comments and
Friday, right? So we will close the comment period then. So that includes all of us if we want to get comments in. So yeah, feel free to send it out if you're hoping to get comments from anybody else.
Don't tempt me. No, I'm just kidding. All right. So that is our rules update. We also have a council training update that I would like to turn over to Sydney to give.
Hi, everybody. Just a few quick notes on the council training. Thank you all for responding to the form that we sent out. Last week, we got everyone's responses in and have that information. So thank you again for that. We are still working on some of the more specific details, but the date and time are set, or the date is set as we sent out in that email last week. And I would just like to draw your attention to an email I sent out last week about badges, OHA badges. If I attached the guidelines for photos, if you're interested in obtaining a badge, please submit your photo by Friday at the latest, which is again in that email, and I can resend it here in just a second too. But that'll give us time to get those photos approved, make sure they fit the guidelines, and then time to get the badges created. And again, it is not a requirement for you to have a badge, but it will be necessary if you plan to travel and need lodging for this gathering. Yeah, so if you have any questions, feel free to reach out. I'm going to resend that email here in just a few seconds, so you'll have that too. And thanks for your time.
All right, any questions on the gathering? What we just talked. Okay. Next, I would like to remind you all that please check your email. We sent an email out regarding the phone line feedback from the council, and we're just hoping to get some more folks to respond to that. So if you have feelings or thoughts or want to aid in us collecting as much feedback on the phone line as we can, please do respond to that. And I think we can go ahead and resend that now as well to make sure that it's at the tippity top of your inbox. And with that, if there are no questions, I think we can pass it back to Sabrina.
Thank you, Jessica. I don't see anything else on the agenda. I just wanted to call out that the last council meeting, we did say that we we're going to come back with some information for Keisha, Nisha, and I believe Ron was part of that conversation. It's on our agenda item for the next tri-chair meeting. I just want people to know that we did not forget the request of what we're working on and the things that we said that we were going to do as tri-chairs. And if we have nothing else, then I don't see why we couldn't end early.
I would not complain.
I do see that Blue has her hand up.
Just a quick question. Are there any updates as far as the media subcommittee being able to reconvene?
I do not have any updates at this time. Oh, sorry, can I just make one real quick announcement? It's Keisha's birthday.
Happy birthday, Keisha.
Happy birthday.
Yes, happy birthday.
What a treat to leave early on my birthday.
Happy birthday.
Thank you.
Yes, definitely. I love your hair too, by the way, Keisha. Anyways, everybody, we're going to end early. Happy birthday to you, and we will see you next time. Bye-bye.